The time is just gone 17 minutes past 9 a.m. this morning, and we are now taking a look at going underground. We're talking about mining, and we have heard about the mining being declared essential services in South Africa during the country's lockdown. Now, many civil society organizations have have expressed their concerns with regards to mining, and the key issue here is with regard to vaccines and vaccinating mine workers and mine affected communities. We joined on the line this morning by Hassen Lorgat. Hassen, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam, and peace be upon you and all peace-loving people.
Yes, welcome. Jazakallah khairan so much for joining us this morning, Hassan. Now, let's talk about these mining communities, obviously, and the miners themselves. There are major concerns at this point in time with regards to vaccines and vaccinations. Considering where we are as a country at this point in time, we're far behind with regard to the vaccine rollout. And now there is a huge focus on miners in the mining communities.
Yeah, Brother Inayat, we rise in terms of this small little booklet, the Constitution, which says that everyone has the right to healthcare, food, water, and social security. But we're living in a capitalist society, highly unequal, and that that the rural folk, those peri-urban, those living around the mines, living around the pool of wealth that is moved to Sandton and the other capitals of the world, but the people surrounding the mines live in dire poverty. And on this very show, I think in April last year, I don't know, I think Azhar interviewed me. We raised the issue that we were opposed to the mines being opened up because we said mining out of necessity. South African mining is deep mining, people go in cages together, and that what happens, they are cheek by jowl, they are next to each other, and there was no way to keep social distancing, and we thought this was a bad idea. The National Union of Mine Workers joined us, or we joined them in making this call that we didn't think it was a good idea. This is the youth wing of the Mine Workers Union, but they de facto recognized it as an essential service. Fast forward to a year, February this year, the president praises the mining sector for making, in the third quarter, an incredible set of profits. He says that this industry recorded a quarter-on growth of 288%, right, on from last year, right? Higher production levels were due to the platinum, gold, etc., etc. But during the time when he said this in February, he promised that with the mining sector, they would be going to vaccinate 60,000 to 80,000 people per day. And the mining sector promised that they will put out money. And all we did in our open letter was to keep them honest. You can't just put out your propaganda there and don't deliver to the people.
Exactly. I think this is one big problem, and this is obviously a problem not only in the mining sector but right across the entire country, where there has been this failure of keeping up to the promises. Now, this open letter that has been written by organizations like yours, the Benchmark Foundation, and the other civil society organizations, in terms of addressing this issue, with regard to the vaccines, but also again, this is a problem that is not being addressed adequately, Hassan, because I am led to believe that there hasn't been even a formal response to your letter.
Well, we had a meeting with the Minerals Council, but I mean, their response is rather weak. They say to us in the media they did not see the letter. We met with them, and not only did we meet with them, they brought in Business Unity South Africa. Kes Kuvadia was there. We explained, and it's true, there are real difficulties. We said to them, listen, you guys, you said in your letter that you are well placed. The president said that the vaccine program will be well met in the mining sector because they have experience in dealing with HIV/AIDS and TB. Now, we said to them, when you could push our government to give you the right to open the mines so you could make business and do whatever else you claim it's doing with it, why is it that you cannot push them to say, we need to roll this vaccine out? And we also asked them to say that Pakistan produced the PAGVAC based on the Chinese Sinotech vaccine, right? And there's also the Sputnik. Why is it that we're only asking that Pfizer and others allow us the patent rights to be released and to be relaxed?
Mm.
We have other relationships through BRICS. We can produce this because it gives you maybe 65, 70%, but at least more people would be able to live off it. You know, what they end up reporting, their own view is that there are 385 mines in the South Africa employing about 500,000 people, and that they have the capacity to do this. But I don't know. They're saying that they're waiting on the government, and they're giving government explanations. We say when you could open the mines, you put pressure on government. Join us. Put pressure on government to say, relax intellectual property rights. Tell Germany to stop doing what it's doing because this is an emergency. People are dying, and we can't put profit above health. And what they end up saying, oh well, the business unity South Africa is divided. They can't do that now, but we really think they should because life comes before profits.
Exactly. And I think what is also critical to understand is how vulnerable miners are and the mining communities are. Because when we're talking about air pollution in the mines as well, and considering that what pandemic or the COVID-19 is actually doing in terms of, respiratory problems, people requiring oxygen and the like. So it does place miners in an extremely vulnerable position in the absence of being vaccinated.
Well, mine workers are already immunocompromised by the nature of capitalist mining. Okay, poor black people already drink polluted water if they get water at all, right? So clearly, these are already immunocompromised people. Their families are there, and they have a very, very good infrastructure. They got health and safety stewards. The mines ran hospitals in this country. So clearly, there's no excuse why they should not be joining in this program. But partly they're waiting for the government, and rightly so, because we support the government-led initiative. But the government must make this step. If Pfizer and others in Germany are not giving us a relaxation of intellectual property rights, we must move on and do what the Chinese and others are willing to offer us so that at least we can save lives. Really.
Well, definitely. And I think the thing is, there seems to be very little focus as far as China and what China can actually do by way of its vaccines. Because, as you mentioned, we're looking to the likes of Europe, we're looking to the likes of the United States of America. Now, obviously, these are countries and these are, it's a part of the world that is deep rooted in capitalism, putting profits above everything else.
Well, a country like Chile has been using a bit of the Sputnik one and also using the Chinese one. And we have this relationship with these countries. We have great relationships. We're part of BRICS. There's already Brazil who has its own problems, but around HIV/AIDS, it did amazing work. Thanks to the fascist Bolsonaro, people are dying there. India, with an equally fascist leader, is causing a lot more deaths there. But India is a great producer of vaccines, and India and South Africa are together putting pressure on these multilateral institutions to deliver a relaxation of intellectual property rights. But there you have already China and Russia, who already the Lancet and others have approved, have seen the efficacy of their vaccines, and what we are having is a failure of government to move in this direction. And this is all the purpose of our letter. Our letter is not sectarian. Our letter is intended to push them that poor people far away from the cities are likely to die if there are no greater interventions.
Hassan, in your mind,
To die in greater numbers if there are no interventions.
mhm, just in your mind, why is the government adopting this type of attitude?
Our government has a correct approach around working multilateral institutions, right? So type system where people just do what they want. So they believe in multilateralism and they're quite progressive on a number of issues around trade, allying with global South countries, and trying to do that. Did amazing work around HIV/AIDS, right? So that's one level. But out of necessity, it takes a long time. America Biden is quite committed to now saying that it be relaxed, that intellectual property rights be relaxed. But you find that Germany is opposed. So they can't move without the other because they all were involved in using public money anyhow to introduce this Pfizer drug. But be that as it may, what we're saying, while that is going on, right, uh, uh, we have this other relationship with China and Russia, who I think are really, really willing to move with this. I mean, if Pakistan could, in the last 2 weeks, a week ago, produce their own vaccine, I believe they did 3 days, indigenized it, put their own labeling on it. Why can't we do it?
Mm-hmm. Exactly.
So
And
I
I don't
really,
think
I,
it's
I really want you. So sorry, brother. I want you to try and get Business Unity South Africa and even someone from the government to come on here to start telling us why they can't do it. Then what is the purpose of having these relationships with BRICS and others? Why do we have it?
Exactly. And I think over a period of time, we've seen just so much talk about vaccine and the vaccine rollout and reaching population immunity and herd immunity. And these are just, fancy terms and fancy words that are being thrown around in the absence. I mean, by now, we are in the middle of the winter season. By now, we would have thought that, we could have reached that target as far as achieving that population immunity or fair amount of the target. And we seem to be lagging. We seem to be falling behind all the time, and this is a major concern. And I think even a bigger concern is when are we actually going to get out of this cycle? Are we going to experience even more waves to come? Are we looking at a fourth wave? Are we looking at a fifth wave? Are we looking at a sixth wave at the rate things are going in this country?
Well, if you look at the Northwest Province, 49% of their caseload, right, comes from this Bojanala Platinum District, right? Uh, and only 17% of the population of that province lives there. So clearly, mining is a contributor to this. It's becoming a super spreader. What we're saying, you praised yourself. You say you have got this great infrastructure. Please roll it out. Don't just say something so that you can be heard. Contribute to the herd immunity that we all crave. But they say these things. They say that we can uh, uh, vaccinate so many people, we can contribute so much, 300 million to roll this out, but then they don't put the same pressure on government as they put on all of us, on public. And as I said it here, we were opposed to the opening because we said this will happen. But then they opened. We need that same fervor to say, if we don't save lives, we'll close the mines. Then you'll watch what will happen.
Well, let's see what develops, Hassan. But for now, we're going to have to leave it at that. Jazakallah, as always, for your time with us here on Salam Media. We wish you all the best. We wish you safety as well, my brother. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam, and thank you for the good work that you do to keep us informed.
Inshallah. Time is just here at 9:30. We come back. We'll be joined by CEO, Penny Appeal South Africa, Shenas Parak.